People with diabetes are at risk of developing problems with their feet. This is because having diabetes can damage the nerves and blood vessels which supply your feet. Your diabetic foot check identifies what risk you have of developing a foot ulcer. The categories of risk are as follows. Low risk. This means you have normal sensation and blood flow to your feet. You don't have any foot deformities and associated overlying hard skin. You will not automatically be referred to your local NHS podiatrist, but if you do develop a problem, you can ask your GP to request a referral. You may then be discharged once the problem has resolved. Moderate risk. This means you have one of the following: either altered sensation or blood flow to your feet, or you may also have a foot deformity with overlying hard skin. As a moderate risk diabetic, you are eligible for NHS podiatry. High risk. This means you have two or more of the following: altered sensation or blood flow to your feet, foot deformity with an overlying hard skin. As a high-risk diabetic, it is essential you are known to your NHS podiatry team and attend all appointments. Here are some simple but very important steps you can take to help keep your feet safe. You, a family member, carer or friend should inspect your feet every day to check for any open areas or sores that could develop into a more serious problem. Check your feet every day. Look for any blisters, cuts, calluses or any areas of thick or hard skin. Check for infection by looking for redness, swelling and heat. You could use a mirror or ask someone to help you. If you do find any wounds, cover them with a clean, dry dressing and check them every day. Don't attempt to burst blisters. Wash and moisturise your feet daily. Make sure you rinse away any soap and dry thoroughly, especially between your toes. Don't soak your feet as this can damage the skin. When they're dry, apply a moisturising cream, but don't put any between your toes. Cut or file your toenails regularly. Keep your nails short. Follow the natural shape of your toe when cutting and use a file to remove any sharp edges. Avoid cutting down the corners of your nails as this puts you at risk of developing an ingrown toenail. Along with your healthcare team, you need to keep a good control of your diabetes, your cholesterol and your blood pressure. This means taking your medication as prescribed, quitting smoking, exercising frequently and maintaining a healthy weight. Check your footwear. Change your socks or stockings every day and check any elasticated tops or bulky seams as these can cause damage to your skin. Check your shoes for any sharp objects that may have pierced the sole and run your hand inside to check for small objects that may have fallen in. Make sure your shoes fit well and don't rub or cause blisters. Avoid corn remedies. These are not recommended as they can easily cause damage to the skin on your feet. If you're a moderate or high risk diabetic, avoid walking barefoot as the sensation in your feet may be reduced and you may not notice if you injure your feet. You may not also notice hot temperatures, so never warm your feet in front of a fire, heater or hot water bottle, and check the bath water before getting in. It is really important to attend your review appointments. These are usually once a year with a GP or diabetic nurse. If you do notice any problems with your feet, such as wounds that have not healed within a few days or signs of infection, please contact your GP practice or podiatrist as soon as possible. Private podiatrists should always be obtained from the HCPC register to ensure practitioners have the correct qualifications and skills to keep you safe. If you are diabetic and develop a wound, always seek advice from your GP or NHS service.